Hi, everyone. Welcome back to another hormone webinar. And today it's all about the estrogens. I'm Zoom Heaton. I'm a pharmacist, and I am the Women's Health Clinical Liaison with Revelation Pharma. So some things we're going to be discussing today. We're going to dive into the history of estrogens, talk about the types of estrogens and their functions, symptoms of estrogen excess and deficiency, estrogen detox, estrogen dominance, hormone testing, benefits of estrogen replacement therapy, estrogen dosage forms, and a few of my clinical pearls. So balance is the key to life. If you want a happy, healthy life, you need to be balanced from the inside out. So I am a bit of a history nerd, and I've always been fascinated by how things originated and when they originated. And so we're going to go over a little bit of the history of estrogens to show you where it all started. So in 1889, Dr. Charles Edward Brown Sicard, who is also the father of endocrinology, experimented on himself with an extract of guinea pig and dog testicles. And with this injection, it resulted in his claim that he rejuvenated himself and suggested that these extracts may have the same effects on women. So ultimately, this was the seed for the commencement of sex hormone therapy. In 1897, ovarian extract was found to be effective for the treatment of menopausal hot flushing. And back then, a lot of the extracts came from the organs of animals, like the pig, porcine, and the cow, bovine. And very commonly done, these extracts, they would extract these hormone molecules and then they would purify them and then administer them to the patients. In 1906, secretions from ovaries were shown to produce estrus, which is cyclic sexual activity in non-human females. And the term estrogen was born, derived from the Greek oistros, which is mad desire, and genin, to produce. In 1917, the role of estrogen was first accurately described in guinea pigs by Dr. Papa Nicolau. In 1917, the role of estrogen was first accurately described in guinea pigs by Dr. Papa Nicolau. And in 1929, estrogen as a hormone was discovered in St. Louis by scientist Edward Dosage. And that estrogen was a kind of estrogen called estrone. And it was actually isolated from a pregnant woman's urine. And a fascinating story that I want to share with you is that many centuries ago, Chinese women, the older Chinese women, would drink the urine of the younger Chinese women, with the concept being that their urine was very rich in estrogens and that they would benefit from it. Don't know if these practices are still going on to this day, but I know it was quite a common practice then. In 1942, Premarin was approved by the FDA for the treatment of menopausal hot flashes. And it was actually Erse, the pharmaceutical company, that created this estrogen. And of course, it came from the pregnant mare's urine, hence the name Premarin. In 1960, the first hormonal birth control pill was approved, and it was estrogen only. And shortly thereafter, around 1966, Dr. Robert Wilson, who was the gynecologist, who wrote the book Feminine Forever, a bestseller, he promoted Premarin, in which he said that menopause was an estrogen deficient disease and that it should be treated with estrogen replacement therapy to prevent living decay. And so he promoted estrogen as the fountain of youth. And so Premarin was wildly popular. But then about the 70s, there was research that showed that unopposed estrogen given to women with an intact uterus actually increased their risk for endometrial cancer. And as a result, in 1980, the estrogen-progestin combinations came about. And in 2002, the Women's Health Initiative study halted the use of hormones due to questions raised about safety. In 2004, the early voice for bioidentical hormones was actress Suzanne Summers, who wrote the book, The Sexy Years. And she claimed that natural bioidentical hormones were the secret to youthfulness and vitality. And then by 2020, integrative medical doctors believed that women fared better when they used bioidentical hormones. And one of those physicians is Dr. Felice Gersh, who is a gynecologist and integrative medicine doctor in Irvine, California, who basically said that pharmaceutical hormones can bind to human hormone receptor sites, but absolutely do not have the same effects as do natural or human identical hormones. So let's look at the chemistry briefly. And the big takeaway here is right here, the raw material that is needed to make all of your sex and stress hormones, cholesterol. And I know in modern days, cholesterol is a bit demonized, and physicians tend to want to lower cholesterol as much as possible. But if there isn't an appropriate amount of cholesterol on board, it's very difficult to make any of your sex hormones. And you have to have cholesterol to make pregnenolone, which is the mother of all hormones. And from there, pregnenolone splits over to all of your sex hormones, your progesterone, your DHEA, your testosterone, and your estrogens. So it is critical to have cholesterol on board in appropriate levels. So let's briefly go through a normal menstrual cycle just to show the rise and fall of estrogen. So estrogen, by day 7 in the follicular phase, it starts to rise. And it's the star of the show in the first phase of the menstrual cycle. And it's there basically to make the egg. And by mid-cycle, it peaks. But then in the luteal phase, the second half of your menstrual cycle, it drops. And it drops all the way down. By day 26, it's pretty much the blood supply is cut off and boom, you start to menstruate there. So estrogen is very proliferative the first half of the menstrual cycle, and then it just basically goes backstage second half of your cycle. So this just shows the estrogen levels moving through the stages of menopause. And so once your last regular period occurs, you're entering the perimenopausal state where your periods are going to be a lot more erratic, and it could be anywhere from 35 to 45, actually anywhere from 35 to 55 years of age. And this is when estrogen levels tend to be very erratic. They rise and fall, rise and fall. And this is where most women go crazy with their menopausal symptoms. And this is when they come into the office and complain and need help. And then once you get to that menopausal state, and this is again, no period for 1 year, then basically all the levels flatline. Doesn't mean that you're not making any, you're just making very, very small amounts, and they're not erratic anymore. So let's get into the types of estrogens. There's 3 main forms of estrogens, but there's probably about 60 different estrogenic entities out there. So we're going to start out with estrone, which is E1. It is derived from estradiol, and high levels of it will stimulate breast and uterine tissue, and it is actually the reserve source of estrogen. It's made by your ovaries and your adrenal glands, the liver and fat cells, as well before menopause, and it is converted to estradiol or E2 in the ovaries. Now, after menopause, very little estrone becomes estradiol since the ovaries stop working. So at menopause, estrone is primarily made in the fat cells. So if you have more excess body fat, then you will make more estrone. Obese women tend to have an increased estrone to estradiol ratio. And if you drink alcohol on a regular basis, it does increase your levels of estrone, which can, of course, lead to an increased risk of breast cancer. Estradiol, or E2, it is the strongest form of estrogen. It's 12 times stronger than estrone and 80 times stronger than estriol, which is E3. It is the main estrogen produced by the body before menopause, and most of your body's estradiol is made in the ovaries, and it is the form of estrogen that you lose at menopause. And 2/3 of menopausal women up to the age of 80 continue to make some estradiol. And women who have had a surgical procedure, either partial or full hysterectomy that affected their ovaries, they do tend to have lower levels of estradiol than other women. And high levels are associated with an increased risk of breast and uterine cancer. Estriol, or E3, it is the weaker of all the estrogens, and it is the main estrogen of pregnancy. And it does have much less stimulatory effect on breast and uterine lining than estrone or estradiol, and it is very protective against breast cancer. And the interesting fact is that it is also an adaptogen. So when given by itself, estriol exerts very strong estrogenic effects, but when given in a tenfold amount in relationship to estradiol, it actually antagonizes the effect of E2. So it kind of balances out the other estrogens, especially estradiol, so that it would not be as proliferative and be dangerous. Some functions of estrone. So adequate levels of estrone are needed to prime testosterone receptor sites, so testosterone can work more effectively. And it regulates the glucocorticosteroid production in the adrenal glands, limiting the production of cortisol to prevent cortisol dominance. And it is a very important player in neurological health, which is necessary for the function of the brain and the CNS, that nerve cells will make their own estrone and in greater amounts than the other two estrogens. Function of estradiol. It helps to do so many things, especially memory. It maintains memory, maintains your bones, increases serotonin, it improves sleep, it decreases fatigue, decreases total cholesterol, triglycerides, LDL, increases HDL. Basically, it has a very good overall cardiovascular profile when used topically. It increases HDL, decreases platelet stickiness. It helps with the absorption of calcium, magnesium, and zinc, increases the growth hormone. Some functions of estriol. It controls the symptoms of menopause, helps with hot flashes and insomnia and vaginal dryness. It benefits the vaginal lining. It helps restore vaginal pH so that you don't get UTIs. It also increases HDL, decreases LDL, blocks the estrone by occupying the estrogen receptor sites on breast cells. So it's very protective that way. It also helps the gut to maintain a healthy environment for the growth of bacteria. For example, lactobacilli helps to reduce pathogenic bacteria. And it has been used to treat breast cancer and MS. Okay, we don't want a lot of estrogen and we don't want too low estrogen. But when we have excess, these are some of the symptoms that bring people in to the clinic. Bloating, brain fog, fatigue, depression with anxiety or agitation. And that's my number one. Most people come in with anxiety and depression. Fibrocystic breasts, swollen breasts, and mood swings. A lot of the women come in and they are complaining of their snappiness and they're very unpopular at home. So the irritability and the mood swings really are bothersome, and they generally come in and just literally are begging for some help. Panic attacks, headaches, heavy periods, poor sleep. They can't fall or stay asleep. Weight gain, especially in the abdomen, the hips, and the thighs. The uterine fibroids, increased risk of developing uterine and breast cancer. Hypothyroid, increased risk of developing autoimmune diseases and water retention. There are some symptoms of estrogen deficiency, which they could overlap with estrogen excess. Depression, anxiety, panic attacks, chronic fatigue, food cravings, joint pain, increased facial hair, brain fog. A lot of people will come in with that. They can't remember why they came into a room, can't remember where they left their keys. Harder to lose weight. And a lot of these women really struggle with their weight. And this is with diet and exercise. They will work out 7 days a week and eat little to nothing and wonder why they're only losing ounces. And then when they start eating normally, they gain pounds, lots of it. Restless sleep, thinning hair, skin, vaginal dryness, arthritis, dry eyes, bladder issues, decrease in libido, and that's mainly due to the men that's screaming for them to come get help. Elevated cholesterol, elevated blood pressure, increased insulin resistance and diabetes, heart attack, headaches and migraines, more wrinkles, oily skin, and osteopenia, osteoporosis. So more symptoms of estrogen deficiency, very common, the strokes and heart attacks, the fibromyalgia, polycystic ovarian syndrome, incontinence, urinary stress incontinence and leakage. I get a lot of that as well. UTIs, vulvodynia, and weight gain. So what is estrogen dominance? So there was a doctor who was a pioneer in bioidentical hormones. His name was John Lee. And in his first book on natural progesterone, he described estrogen dominance as a condition where a woman can have deficient, normal, or excessive estrogen, but has little or no progesterone to balance its effects in the body. So even a woman with low estrogen levels can have estrogen dominance symptoms if she doesn't have any progesterone. So estrogen dominance doesn't necessarily mean that you have a lot of estrogen on board. It just means that it's not well balanced with progesterone. Here is a nice graph that shows the estrogen dominance that occurs as we move on into our menopausal years, and how progesterone drops a lot more than your estrogen. And between the ages of 35 and 50, notice there's a reduction in estrogen by 35%, but it's a lot more. It's like 75% reduction of progesterone. And so this gap between progesterone and estrogen widens. And so at menopause, there's basically higher estrogen compared to progesterone. And this is where a lot of people run into that estrogen dominance issue and have many, many symptoms. So what are some causes of estrogen dominance? There is a myriad of causes. So let's start with diet. And of course, a lot of our animals are injected with growth hormone, antibiotics, they got to be fattened up. And of course, they go into our bodies and they disrupt our endocrine system and create imbalances that are very harmful. Our water, of course, there's synthetic and natural estrogens from livestock and prescription medications. There's also industrial chemicals and plastics, also chemicals in landfills that end up in our water supply. And the filtration is not so good. And so we keep drinking this water that is polluted, if you will, with a lot of these estrogens that have seeped in. And again, it's just overrunning our bodies. Xenoestrogens are basically chemical estrogen mimickers, and they're basically in all of our personal care products. So anywhere from cosmetics to shampoos, lotion, soaps. They have parabens and phthalates, plastics, that have bisphenols in them, water bottles, food wraps, storage containers. People are heating their food in plastic. Gut dysbiosis. The gut microbiome does regulate the circulating estrogen. And the way it does that is it does use an enzyme called beta-glucuronidase. And that is there basically to break down a lot of these chemicals, including estrogens. And when you've got overgrowth in your gut of bad bacteria, it's just going to reabsorb all of your old estrogens. It goes back into circulation and does harm. And so it increases that risk for estrogen dominance. Another cause is poor estrogen detox. We talked about the gut not being healthy, and now it's the liver. If your liver is sluggish, a lot of times what you're packaging up, the old estrogens to be gotten rid of, you just basically unpackage them again, and they're just reabsorbed into the system, and they can't leave the body. Heavy metals, calcium, lead, and mercury have estrogen mimicking properties, and a lot of us love to eat fish. So we just have to be careful in choosing the right kinds of fish where there's lower mercury levels. Body fat, excess body fat, especially, of course, for us women, stored in hips, waist, and thighs, is a major cause of estrogen dominance. So losing a little bit of weight goes a long ways. So synthetic hormones in conventional birth control and hormone therapies, they can be very difficult for the liver to break down. And of course, this leads to DNA damage, which can increase, of course, your risk for breast and endometrial cancers. And chronic stress. It should have been first, but we're going to be discussing chronic stress and the stress hormones that are involved in the stress response later on in future webinars. But with chronic stress, the body can steal progesterone to make more cortisol so that it can support your need for energy. And when you're chronically stressed, it's going to create this imbalance when your progesterone is being stolen. So this definitely increases your risk for estrogen dominance. So some symptoms of estrogen dominance looks very familiar with all the symptoms of excess and deficiency. So you have hot flashes and breast tenderness, moodiness, irritability, panic attacks, of course, the weight gain, premenstrual syndrome, abnormal menstrual bleeding, the fibrocystic breast, the uterine fibroids, the fatigue. The fatigue is basically all around, whether you have excess or deficiency or estrogen dominance, you got fatigue, loss of sex drive, depression, anxiety. Some health risks associated with estrogen dominance, of course, the increased risk of breast and uterine cancers, an increase in some autoimmune diseases, because of course, with estrogen dominance in some of these autoimmune conditions, it does seem to enhance the immune system's inflammatory response. So of course, it increases the antibodies that attack the body's own tissues. Hashimoto's and thyroid dysfunction. Estrogen dominance does increase the levels of thyroid binding globulin, which can of course bind up thyroid hormones. Candida. Yeast can be a big problem in estrogen dominance, since candida, based on research, can actually increase candida's virulence. And this is why women taking traditional HRT or birth control tend to show high estrogen levels. And of course, they're more susceptible to yeast infections. So let's go over estrogen detox. It's important that we understand that with estrogen, whether it's natural or with supplementation, we have to be able to use the estrogen, but we also have to be able to break it down to get rid of it as well, for us to have that balance. Estrogen detox occurs in 3 stages. And in phase 1, estrogen is broken down and it's transformed, so it can be ready for phase 2. So you're pretty much, there's 3 pathways that estrogen can go in phase 1 detox. So it can move through the 2-hydroxy, which is the most favored pathway. It's the good path. The 4-hydroxy is the least favored, and it can be more carcinogenic or cancer causing because it has more risk for DNA damage. And then 16-hydroxy, this pathway has the strongest binding effects to estrogen receptors. So that's why it's considered to be the most proliferative. And of course, this means that this pathway can, of course, cause, some unwanted symptoms like heavy periods and tender breasts and painful periods. Higher urinary levels of this have been linked to breast cancer. But again, the research is ever evolving. And now there's some research that says that 16-hydroxy may be protective in hypertension. We'll just have to watch on that one. Phase 2. This one helps to prepare the estrogen to be removed from the body. So it's packaging it up, preparing to release it. So it makes it more water soluble, so it can be easily removed. And with phase 2, methylation needs to be healthy because it is an important process that transforms the estrogens to be removed from the body. And of course, poor methylation could be due to poor nutrient status, where you don't have enough folate or B12 on board, which is so critical in the methylation process. And then you have to look at the genetic variants on the genes like COMT or MTHFR, which I test pretty much everybody for that, so that it makes it easier to be able to support people who actually do have these variants. And of course, other factors like stress. So poor methylation can, of course, lead to hormone imbalance, poor detox, poor sleep, mood changes, and low energy. So phase 2 is critical with methylation. Phase 3 is basically removal. And so you packaged everything up, all the bad stuff in phase 2. And now in phase 3, You're ready to pretty much get rid of it through bile, urine, or stool. So you want to be sure that phase 3 is working properly so that you don't unpackage that estrogen midstream and it goes right back into circulation. So this is a really neat diagram to sum it up using the bathtub analogy. Phase 1, where, how much are you filling up in the bathtub? And then phase 2, of course, how quickly can you drain the bathtub? And is there any blockage there? And then, of course, phase 3, is there blockage in the drain? So it's a really neat summation of how estrogen detox works. I just really like this diagram of showing the healthy path of estrogen metabolism versus unhealthy. So basically your liver and your gut have to be healthy for your estrogens to be absorbing, it works better, and then it has to be broken down and eliminated well. And here again, this is going to provide the good balance. And with an unhealthy microbiome and liver, you're just going to reabsorb all those nasty estrogens again. And that's where the harm comes in. So it truly is all about hormone balance. You have to be able to use your estrogens, but then you also have to get rid of it. So hormone testing, where do we begin? So the only way that we're going to know how much to supplement and what we need is to do testing and know baseline hormone levels. And there's 3 ways to test. You can actually do a saliva test, urine test, and blood test. So we'll start with saliva testing. It is the preferred method of testing in perimenopausal, menopausal women, and of course, women with PMS symptoms or any other hormonal imbalances. The beauty of saliva testing is that it is non-invasive. It can be done at home. You don't have to be in the office to do it. And once you're done, you can actually drop it off at a UPS drop box. So it's very convenient. Saliva is also very stable in extreme heat and cold. So that's not a worry. It's considered to be the most accurate way to assess bioavailable hormone levels. And of course, due to the lipophilic nature of hormones, they have to be bound to carrier proteins when traveling through serum, of course, and that's what renders them inactive. And so in salivary testing, you're going to get more of the free hormones. They're not bound. And so the bioavailable amount of the hormone must be measured and not the total hormone level. And it is considered the optimal way to measure hormone levels because it does allow for changes over an entire day or even a number of days, as opposed to a one-time blood stick where basically the levels are only at the time of the test. And it does accurately measure topically dosed hormones. With serum testing, it measures the protein-bound, biologically inactive hormone levels in the body. And for steroid hormones to be detected in serum, they have to be bound to circulating proteins. So this bound state, they're not able to fit into receptors in the body. And so they can't be delivered to tissues. And hormones are active in tissues. That's where they work. And so these steroid hormones in blood are considered inactive or non-bioavailable. And hormones applied topically cannot be measured accurately in serum since the hormones applied transdermally are underestimated in the blood. And this could result in overdosing. So this is not the best test to dose hormones with. Urine testing. So it measures the downstream metabolites or the breakdown products of sex hormones. And it's very beneficial since it does help to make sure that the hormones are broken down into metabolites that decrease the risk of disease and not increase the risk of other pathological processes. Hormones in the urine are reflective of the combination of both endocrine production and peripheral production of the hormones and their metabolites. So basically, urine testing reflects hormone metabolites that can help you to determine, based on your medical history, whether it would be appropriate for you to be on hormone therapy, because it could actually show certain risks based on the results of the metabolites that show up. Estrogen replacement therapy. So these are some of the benefits of estrogen replacement therapy. Of course, the management of symptoms. So many women come in for that. These symptoms are nuisances, like hot flashes and night sweats and chills. Of course, it improves mood, improves sleep, increases sex drive, helps manage weight. It's very cardioprotective, improves bone density, which a lot of people come in for because, a lot of these people are diagnosed with brittle bones, osteopenic, osteoporosis. They've probably had a history of their mothers or family members who, have had who've had falls and have had to have hip surgery. So they're very, very scared of losing their bones. And it also improves and maintains cognitive function. Of course, memory loss is a big deal. Anti-aging skincare, growth and repair, immune system support, and of course, it can be customized as well to your individual need. So what are the types of hormone replacement? We've got synthetic HRT, which of course, it just means that the chemical structure is not what your own body makes. So I call it the alien molecule. And then we have the natural HRT. Of course, those are hormones that are biologically identical. So the molecular structure is identical to the ones you're making in your body. Now, they could be natural too, meaning the source that it comes from is natural. So it could come from the soy or the yam plant. And of course, compounded HRT, and they're basically natural HRT, but they're hormones that are mixed and they're customized in a compounding lab for the individual need versus a one size fits all. So estrogen dosage forms, there's a lot on the market. There's so many different ones. And to start with, there's a wide variety of the oral versions. And of course, Bijuva is the most current, where they're touting that as the bioidentical combination. But again, it's oral estradiol, and what they're putting in prometrium here with the progesterone. But there are so many different combinations, ranging from just estrogen alone to combinations of estrogen and progestins, which of course are the synthetic progesterone. Then you have patches as well. Same thing, estrogen alone versus the combinations. And then it's also available in gels and topical spray. And of course, the vaginal products are also there. And of course, injectables are available if you want, this is more invasive, but it is available. The compounded estrogen, you've got in so many different dosage forms. Again, oral capsules, lozenges, troches, sublingual drops, topical creams, gels, ointments, lotions, sprays, suppositories, vaginal creams, gels, and of course, and even pellets. So can all be compounded based on need, based on preference, based on absorption. It's amazing. It's amazing what we can do to get to the patient and make sure that they get what they need. So the advantages of compounded hormone replacement therapy, of course, the hormones are coming from a natural source and they are bioidentical. So the molecular structure is identical to the ones that you're making in your body. It is customized to your individualized need. And it is more easily tweaked versus the standard treatments. And this is how you can get people to goal a lot easier, I think. With commercial products, generally, they have very specified dosages and they're fixed dosages. With compounded hormones, it is a lot easier to be able to tweak to get people to the right dosage. And basically, I call that, their sweet spot. Hormones can be mixed into different dosages, and special routes of administration are available depending on your personal biology. And of course, different bases for topical preparations are available for you and your unique physiology. So what's right for you? So there are some factors, of course, to consider. Age, of course, if you are not menopausal yet, but you're in that transition of perimenopause, you may not need estrogen if you're still cycling. So we may need to just cycle using progesterone. And again, it all depends on basically what's going on with you. Family medical history, is there cancer in your history? How long Was the person who had breast cancer, did they have breast cancer based on, was it spontaneous, or were they on HRT and they developed breast cancer? So we have to look at all of those factors. Of course, the severity of menopausal symptoms. I mean, there's a gamut of severity. So there are people who have very mild symptoms, and then there are people who just literally they cannot function because their symptoms are so bad. And of course, lifestyle, how stressed out are you? How busy are you? Convenience, and of course, personal preference. So some clinical pearls just based on what we've talked about. Earlier when we were talking about the biochemistry of sex hormones, and I said that cholesterol was a major raw material for making all of your hormones. Well, you have to have a cholesterol of at least 140 to make pregnenolone and all of the other sex hormones. So anything lower than that is going to be problematic, since you will not be able to make all your sex hormones. Estrogen must be transdermally applied for women who to have heart protection. Estrogen taken orally is not the best form, just because it can promote clotting. And once a woman loses her estrogen, starting hormone therapy immediately can give her much more heart and brain protection. Does that mean that if she doesn't start it immediately, that she will not have heart and brain protection? It does not mean that. It just means that she will benefit more on the front end, but she can start hormone therapy at any time and still reap the heart and brain protection. Estriol applied on the skin can decrease pore size and decrease the depth of wrinkles. So estriol is amazing for skincare. If your estrogen levels are low and you take testosterone alone, it can increase your plaque formation in the vessels of your heart, which increases your risk for heart disease. So hormones are very, very intricate, and it is really all about the balance. And hormones, sometimes given alone without the balance of other hormones, could increase risk for different conditions. And this is a big one. So estrogen levels, if your estrogen levels are low and you just give testosterone, you can increase plaque formation. And here are some good reads and some good guides on hormone management. And these are some of my favorite. Connect with us if you have any questions or any inquiries. We will be glad to talk with you and connect with you. And thank you so much for your attention today. And please tune in for the next hormone webinar coming soon. Take care.